The world changed dramatically in late 2019. A new virus emerged, altering the course of our daily lives. It caused a disease we now know as COVID-19, which led to unprecedented global health challenges. Scientists quickly identified the virus as SARS-CoV-2, a novel coronavirus. It first appeared in Wuhan, China. The virus quickly spread, causing widespread concern. It moved from person to person with alarming speed. Within weeks, it reached other countries, crossing borders effortlessly. By early 2020, the World Health Organization declared a pandemic, signaling a global crisis. The origin of the virus is still uncertain, shrouded in mystery. However, scientists believe it likely originated in bats, a common reservoir for coronaviruses. It then jumped to humans, possibly through another animal. This likely occurred through an intermediate animal, though the exact species remains unknown. The exact animal is unknown, adding to the complexity of tracing the virus's origins. Understanding the virus's origins is crucial for preventing future outbreaks and protecting public health. It helps us prevent future outbreaks by informing better surveillance and response strategies. The rapid spread of COVID-19 was alarming, catching many off guard. Several factors contributed to this, including high human mobility and dense populations. Global travel played a significant role, facilitating the virus's rapid dissemination. People moved easily across borders, often unaware they were carrying the virus. This allowed the virus to hitch rides on planes, trains, and other forms of transportation. Additionally, the virus was highly contagious, spreading through respiratory droplets. Many people who contracted it showed no symptoms, making it difficult to control. This meant they unknowingly spread the virus to others, exacerbating the outbreak. The emergence of COVID-19 highlighted a critical lesson for humanity. We live in an interconnected world. Diseases can spread rapidly, and global cooperation is essential. We need to be prepared for future outbreaks, ensuring robust health systems and international collaboration. COVID-19 is a respiratory virus that has significantly impacted our daily lives. It spreads primarily through respiratory droplets, which are tiny particles released into the air. These droplets are expelled when an infected person coughs, sneezes, or even talks loudly. If these droplets land on your nose, mouth, or eyes, you can become infected with the virus. The virus enters the body through these mucous membranes, which are gateways to our respiratory system. Once inside, it begins to multiply rapidly, taking over the host cells. It specifically targets cells in the respiratory system, including those in the nose, throat, and lungs. These cells are crucial for breathing and are easily hijacked by the virus. The virus uses these cells to make copies of itself, spreading further within the body. The virus has spike proteins on its surface, which play a critical role in infection. These spike proteins act like keys, allowing the virus to unlock and enter human cells. They bind to specific receptors on the surface of human cells, facilitating entry. This binding process allows the virus to penetrate the cell membrane and enter the cell. Once inside, the virus releases its genetic material, which takes control of the cell's machinery. This material hijacks the cell's normal functions, forcing it to produce more virus particles. It turns the cell into a virus factory, churning out new particles that can infect other cells. These new particles then burst out of the cell, ready to infect neighboring cells and continue the cycle. This relentless cycle of infection and replication leads to widespread infection, affecting entire communities. Our immune system is our defense against invaders, like viruses. When SARS-CoV-2 enters the body, the immune system launches a complex response. The first line of defense includes white blood cells. These cells work to neutralize the virus. They engulf and destroy virus particles. This process helps to limit the spread of infection. The immune system also produces antibodies. These are specialized proteins. Antibodies target and bind to the virus. This binding neutralizes the virus. It prevents the virus from infecting more cells. In some cases, the immune response can be too aggressive. This can lead to inflammation and tissue damage. This is especially true in severe cases of COVID-19. The body's own immune response can contribute to the severity of the disease. COVID-19 and the flu share some similarities. Both are respiratory illnesses. They can cause fever, cough, and fatigue. However, there are key differences. COVID-19 is more contagious than the flu. It also has a higher mortality rate. This means a greater percentage of people who contract COVID-19 will die from it. The reasons for these differences are complex. One factor is the novelty of the virus. Our immune systems had no prior exposure to SARS-CoV-2. This made us more susceptible to infection. Additionally, COVID-19 can cause more severe respiratory complications. Another difference is the availability of vaccines. Flu vaccines are widely available. They are updated annually to target circulating flu strains. While COVID-19 vaccines have been developed, their availability and distribution vary globally. Section 5. Overwhelmed hospitals. The rapid spread of COVID-19 placed a tremendous strain on healthcare systems worldwide. Hospitals became overwhelmed. They faced shortages of beds, staff, and essential equipment. The surge in patients put a strain on resources. Hospitals struggled to provide adequate care to everyone. This included patients with COVID-19 and those with other medical conditions. The shortage of ventilators was particularly acute. Ventilators are machines that help patients breathe. They are essential for treating severe cases of COVID-19. The demand for ventilators far exceeded the supply. The strain on healthcare systems highlighted the importance of public health measures. These measures aim to slow the spread of the virus. This helps to prevent hospitals from becoming overwhelmed. Section 6. Stopping the spread. Controlling the spread of COVID-19 required a multi-pronged approach, combining both individual actions and collective public health measures. This included individual actions like wearing masks and washing hands, as well as public health measures such as social distancing and testing. These efforts aim to slow the transmission of the virus and protect vulnerable populations. Hand washing is one of the simplest yet most effective ways to prevent infection. It is a basic hygiene practice that everyone can follow. Washing your hands with soap and water for at least 20 seconds helps to remove viruses and other harmful pathogens. Hand sanitizer is also effective when soap and water are not available, making it a convenient option for on-the-go hygiene. Social distancing is another crucial measure. It involves maintaining a physical distance from others to minimize the risk of virus transmission. This involves maintaining a physical distance of at least 6 feet from others, especially in crowded or enclosed spaces. It helps to reduce the likelihood of respiratory droplets reaching you, which is a common way the virus spreads. Wearing masks in public indoor settings also helps to prevent transmission. Masks are especially important in situations where social distancing is difficult to maintain. Masks act as a barrier, blocking respiratory droplets from spreading to others. They block respiratory droplets from spreading, thereby protecting both the wearer and those around them. Section 7. Early action is key. Early intervention is crucial in controlling outbreaks. This includes quickly identifying and isolating cases. Contact tracing is also essential. This involves identifying and monitoring people who have been in contact with an infected individual. Testing plays a vital role in early intervention. It allows us to identify infected individuals. This helps to isolate them and prevent further spread. Treatment development is another critical aspect of the response. Researchers work tirelessly to develop effective treatments for COVID-19. These treatments aim to reduce the severity of the disease and prevent death. Section 8. The long road to recovery. The COVID-19 pandemic has had a profound impact on the world. It has affected our health, our economies, and our daily lives. The road to recovery will be long and challenging. Vaccination is a key tool in ending the pandemic. Vaccines help our bodies develop immunity to the virus. This reduces the risk of infection, severe illness, and death. However, achieving widespread vaccination is a complex undertaking. It requires global cooperation, equitable distribution, and public trust. Overcoming vaccine hesitancy is also crucial. The COVID-19 pandemic has taught us valuable lessons. It has highlighted the importance of public health infrastructure, global cooperation, and scientific research. It has also underscored the importance of individual responsibility and collective action.